So on one level you could say a lot of money has been spent, but on another level I would say not enough money is spent. If we think about the amount of money we put into McDonald's every year, it's just beggars belief, right? I mean, as a society we make some pretty strange choices. And when it's to do with people's lives and human health, we don't spend enough. That is the frank truth. Okay, so the question is, what is exciting going forward? Well, the first and the most important thing to say is making an accurate diagnosis. The gene mutation tests need to be rolled out nationally. There needs to be equity of access for a patient regardless of where they live. That has to be done. That's not research, that's implementation. That requires a reconfiguration of the NHS. And it requires hospitals not to block progress in doing that. And there's a lot of debate and discussion about this. Accurate diagnosis. And the other thing that the gene mutations do is that they're prognostic, meaning that they give some insight into the future. It's incomplete at the moment, but there's data now on thousands of patients who have a mutation profile and they've been followed up for 10 years, and we have a much better sense of what is a quote-unquote bad mutation more likely to progress to leukemia, mutations that are less likely to cause progression to leukemia. So we need to build that database up. We need to collaborate with people around the world who have similar databases so that we have accurate prognostic tools in addition to diagnostic tools. Why is this important? Well, it's important because you can give proper advice. If you're not sure about the diagnosis, and if you're not sure what that diagnosis means, how can you advise anybody as to what the best course of treatment is? If you know that this is going to be an indolent condition over many years, you're less likely to advise therapy that's harmful. If you know that the course of the disease is more likely to be aggressive, you're more likely to recommend aggressive treatment. It's common sense. The second thing I would say is we need to understand a lot more about the basic biology of why things go wrong. And there are lots and lots and lots of new medicines coming through. Some to do with making the cells grow up properly, some to do with combating the consequences of abnormal blood production, iron overload. We've talked about that. Well, that drug needs to be made affordable. And the United Kingdom needs to kind of engage more nationally in a debate around what is affordable, what is unaffordable. Some of the drugs are already here. But in the longer term, I think this whole business of redirecting your immune response against cancer is really going to be a major game-changing therapy. So we will look back in 30 years' time and think of transplantation as we do it today as rather crude. Curative, but crude.